Hi, everyone. Good afternoon, good morning, wherever you may be. This is Dr. Corolla Okogbaa with Louisiana Center for Eyes. And happy new month to you. This month, the month of June, is Cataract Awareness Month. And I'm excited about this month and this Awareness Month just because, so many people have heard or have heard about have heard the word cataract and not sure exactly what that means. They just know their mom had it, or the doctor told them they had cataracts, or their grandmother had cataracts, and they want to know what exactly is a cataract. And so I'm here to answer that question for you. And so as we go on this month, if you happen to have any other questions about cataracts and cataract surgery and anything really about the eyes, just post it and we'll be sure to try to answer your questions for you as much as possible. So today, let's talk about cataracts. Well, what is a cataract? And so with our eyes, okay, we have different structures in our eyes that we're born with. And so we have the cornea, which is the front of the covering of the eyes, and then we have, as we go from front to back, you have your eyelids, then your cornea, then your iris, which is the colored part of your eyes, and then right through that you have the pupil, and once you pass the pupil, you get to the lens. Okay, so the lens is like this round structure that's inside of our eyes, and we're born with it. It's crystal clear. I always describe it as almost like a marble, for those of you who remember what a marble looked like back in the day. Some people used to play marble. So if you think about a marble, the lens kind of look like that. And it's crystal clear, so that when you are looking at something, an image, the lens project that image to the back of your eye, to your retina. Okay, so that's the job of the lens. And the lens also changes to help you focus. If you're focusing close up, or you're focusing at your computer, or you're focusing far away, your lens help with that. Okay, so over time, particularly with age, the lens starts to get a cloudiness, okay, in it due to protein condensation and all of that jazz. Just know that it gets cloudy, okay? So that cloudiness is what we called the cataract. So just to be clear, it's not a new growth that comes up on the eye, okay? It's not a new growth. It's really your own natural lens that gets cloudy with age, typically. And that's what a cataract is. As it develops, it gets a little cloudier, and cloudier. And at some point, it may start to impact the eyes. You may notice, okay, I need more glasses, or I need good lighting to read. Some people, once it start to have an effect, you may have glare, particularly at night. And so that cloudiness in the lens is what's causing all that, and we call that cataract. Now, did you know cataract is actually the most common cause of blindness worldwide? Yeah, amazing, isn't it? With all the technology we have, that's still the most common cause of blindness in the world. However, if we're able to catch it early, and we have technology, we have excellent surgery now that can really help improve vision and help individuals regain vision. So yeah, I just wanted to throw in that little fact about the eyes and how cataracts impact the world. Now, when does it start? When does that cloudiness start? When can you say, oh, it's a cataract? Typically, I want to say for most people, it starts to show up really in your early 50s. Now, there are exceptions to everything, right? But typically, that cloudiness start in your early 50s, slowly gets a little cloudier, and it's just aging changes in the eye and in the lens. And it can and it could stay like that for years, kind of slowly growing, slowly getting cloudier, and then sometime it can accelerate and start really causing vision changes. And then that's when we have to consider, okay, what's the ultimate treatment we got to do for cataracts in order to improve the vision. However, there's other things that can cause cataracts to come up earlier, or to come on earlier, or to start earlier. One of those is just, we call them congenital cataracts. So some people can literally be born with a cataract in their eyes. And because that can actually cause significant issues for an infant, usually they're having cataract surgery like ASAP if they have a certain type of cataract, or if that cataract is blocking the development of the vision in the child. So yeah, so it's called congenital, meaning you're born with it. Now, other things that can cause us to develop cataract without necessarily from age. For example, if you have an injury to the eye, okay, an injury can cause either a quick cataract to come on where that lens gets damaged and really gets cloudy, or it causes the cataract to accelerate, or just gets worse, or progresses really, really quick. And so an injury to the eyes can do that. An injury can also just completely dislodge the lens out of position, but that's a different topic. But yeah, so an eye injury can do that. Also, certain conditions, such as if you're one who have chronic inflammation in the eye for any reason, like chronic iritis, some people who have autoimmune conditions can develop cataracts earlier than normal, just because of the chronic inflammation that the eyes tend to have. The other thing too, if you're one who takes a lot of steroid eye drops, and sometimes it's because we are treating the iritis, and the steroids over time can actually accelerate the process along with the inflammation. So cataracts can develop in those circumstances. Other conditions that can cause cataracts to accelerate sooner than later is a very, very common one. Very, very common. I'm sure you can guess that. Yes. Diabetes. Yes. So when the glucose, or the sugar in your body is elevated, that's what you call diabetes. So when it's chronically elevated, when it's really high or high constantly in your body, well, guess what? The eye loves to absorb all of that glucose, and a lot of it goes straight to the lens and causes that cloudiness and accelerate the cataract process. And so sometimes there's young people, even in their 20s, we're doing cataract surgery on them if they have really bad diabetes, or some people in their 40s, we're doing surgery on if diabetes is a factor. Basically, just uncontrolled diabetes causes the acceleration of cataract development in the eye. So very important that we keep whatever conditions we have going on in our bodies. We really want to control any other health condition, and that will help cataracts from growing so quickly in our eyes. So those are the overall situation, the overall facts about cataracts I wanted to talk to you about. So our next video, we can talk about, well, is there anything we could do to slow the development of cataracts? And we will address that next time. So if you found this video helpful, or if you know anyone who's talked about cataracts, or they were told they had cataracts and was not sure what it was, please send them this video. And if you happen to be in the Baton Rouge, Louisiana area, come on by. And if you haven't had an eye exam recently, please come on in. Let's get those eyes checked. Let's see if you are developing cataracts or not. And if you have any other conditions like diabetes, you definitely need to get your eyes checked. So check us out, www.lacenterforeyes.com, or drop by Louisiana Center for Eyes in Baton Rouge, Louisiana. Okay, that's it. Share this video. Thank you. Bye-bye.